students, good day to all of you. This is Dr. BK for you, and today I am going to discuss about the pelvic vessels and the nerves of the pelvic region. Now first, with respect to the pelvic vessels, what are the major arteries supplying the pelvis? So the pelvic viscera, the wall of the pelvis, and all those are mainly supplied by the internal iliac artery, which forms the major artery supplying the pelvis. Okay. So the internal iliac artery, which you see here, mainly divides into anterior division and posterior division. The two divisions of the internal iliac artery mainly supply the structures in the pelvis. Now other minor arteries which are contributing to the blood supply of the pelvic cavity and the pelvic wall is mainly ovarian artery or gonadal artery, mainly ovarian artery in case of the females. Then you have the median sacral artery, which is a direct branch of the abdominal aorta, and finally superior rectal artery, which actually descends from the inferior mesenteric artery. They anastomose with the middle and inferior rectal artery. So now let us try to understand one by one these arteries. So these are the branches which you are able to see here. The abdominal aorta dividing into the two common iliac arteries at the level of L4 vertebra. The two common iliac arteries divide into external iliac artery and internal iliac artery. So external iliac artery passes behind the inguinal ligament, and it is going to give rise to the blood vessels of the lower limb. The internal iliac artery divides into an anterior trunk and posterior trunk, and again the anterior trunk branches are very, very important because they are mainly responsible for supplying the most of the organs of the pelvic region, that is your bladder, uterus, ovary, vagina, rectum, all these structures. So what are the branches of the anterior trunk of internal iliac artery? They mainly run along the lateral wall of the pelvis and supply most of the pelvic viscera. So these are the branches: obliterated umbilical artery, superior vesicular artery, so vesicle which refers to the bladder, inferior vesicular artery, again which refers to the bladder, obturator artery. Then you have the uterine arteries, vaginal artery, middle rectal artery, internal pudendal artery, superior gluteal artery, inferior gluteal artery. Okay, so these are the branches. So we will try to just see in short about these branches and how do they supply. So these are the branches from the anterior division. So the anterior division branches are mainly obliterated umbilical. Then you have the superior vesicular artery. Then you have the inferior vesicular artery. Then you have the obturator artery mainly. Then you have the uterine artery. Then the two terminal branches of the anterior trunk are the inferior gluteal and the internal pudendal artery. Whereas posterior division branches, there are only three branches. One is the Iliolumbar, other one is the superior gluteal, and then you have the lateral sacral artery. Now first coming to the umbilical artery or obliterated umbilical artery. Okay, so here you are able to see the obliterated umbilical artery. So if you look, it is from the anterior division of the anterior division of the internal iliac artery. The umbilical artery actually conveys deoxygenated blood from the fetus to the placenta. So that is its function in the fetal life. Of this, what happens is the distal part of the artery obliterates. So it is not functional because once the placenta's function is over after the birth, naturally what happens is this part of the artery obliterates, forming the medial umbilical ligament. Forms the medial umbilical ligament. The proximal part of the umbilical artery becomes the superior vesicular artery. The superior vesicular artery mainly supplies your upper part of the urinary bladder. The superior vesicular artery mainly supplies the upper part of the urinary bladder, and one of the branches accompany the vas deferens, and then it reaches the testis to anastomose with the testicular artery. Okay, so mainly supplies the upper surface of urinary bladder. So that is the superior vesicular artery. Okay, and umbilical artery, what happens is it obliterates the distal part. So mainly its function in uterus, it carries deoxygenated blood from fetus to the placenta. Okay, so that is what this part of the artery, obliterated umbilical artery, is actually degenerated into medial umbilical ligament. The next artery, what we see here is the obturator artery. So here you are able to see the obturator artery. It passes forwards along the lateral wall of the pelvis and accompanied by the obturator nerve. So they enter through the obturator canal, and thereafter it divides into anterior and posterior branches, okay, accompanied by the vein and the nerve, and then it divides into the anterior and posterior branches. Okay, so within the pelvis it supplies branches to the urinary bladder, and it gives branches to the ilium and pubis. It gives branches to the obturator artery, gives branches to the ilium and the pubis. Now, one of the pubic branch or the pubic branch of the obturator artery anastomoses with a similar pubic branch of the inferior epigastric artery. Okay, and then if it is enlarged, it is called as abnormal obturator artery. Okay, it is called as abnormal obturator artery. That is the pubic branch of obturator artery if it is anastomoses with the pubic branch of inferior epigastric artery, and then it is actually called as abnormal obturator artery. So this has to be taken care while repairing a strangulated femoral hernia. So if you are going to incise the lacunar ligament, then you should be careful that you don't ligate the abnormal obturator artery. Then apart from the obturator artery is going to supply the muscles of the adductor compartment of the thigh. Only in the pelvis it gives a few branches to the urinary bladder. The next artery is inferior vesicular artery. So the inferior vesicular artery is again one of the branch of the anterior division of the internal iliac artery. Okay, so here you are able to see the abnormal or anomalous artery, which the pubic branch anastomoses with a similar pubic branch of the inferior epigastric artery. Okay, so this inferior vesicular artery mainly supplies the lower part of the urinary bladder, and in females actually it is represented as the vaginal artery. And apart from the lower part of the urinary bladder, it also supplies the ampulla of vas deferens, prostate gland, and seminal vesicles. Okay, so it also supplies the prostate gland, seminal vesicle, ampulla of vas deferens, and also terminal part of your ureter. It also supplies the terminal part of the ureter. So here you are able to see the inferior vesicular artery. Mainly supplies the lower part of urinary bladder, terminal part of ureter, ampulla of vas deferens, prostate gland and seminal vesicle. So superior vesicular artery, and here you see the inferior vesicular artery supplying the seminal vesicle and the prostate gland and ampulla of vas deferens. The next artery is vaginal artery. As I told you, this vaginal artery corresponds with the inferior vesicular artery in case of the males. Okay. So this vaginal artery, what happens is, it runs along the wall of the vagina, and then along with the similar branches of the opposite side, it anastomoses in front and behind the walls of the vagina and forms azygos arteries. It forms the azygos arteries, and it mainly supplies the vagina, bulb of the vestibule, females bulb of the vestibule, and also lower part of the urinary bladder and rectum. It also supplies the lower part of urinary bladder and rectum. So vaginal artery in case of females, in males it is actually the inferior vesicular artery. Okay. So here you are able to see the vaginal artery. So it anastomoses with the fellow artery of the opposite side and forms azygos arteries, and it mainly supplies also the bladder and also branches to the rectum. The next artery, very important artery in case of females, is the uterine artery. So it is very large. The uterine artery is actually large in case of the females. So here you are able to see the uterine artery. So it travels along the up to the supravaginal part of the cervix. Okay. So accompanies the lateral side of the pelvic part of the ureter, and then up to the supravaginal part of the cervix. And then what happens? It crosses the ureter in front and above. Okay. It crosses the ureter in the front and above, and then what happens is, then it runs along the lateral wall of the uterus. It runs along the lateral wall of the uterus within the layers of the broad ligament, and then it ascends above, turns laterally below the uterine tube, and then what happens is enters the ovary through the mesovarium and anastomoses with the ovarian artery. Okay. So during its course, it crosses the ureter in front and above at the lateral angle near the uterovaginal junction. So here you are able to see the uterine artery. So along the lateral wall of the uterus, you can see it's running between the two layers of the broad ligament. Then it is related to the uterine tube. Then through the mesovarian border, it enters and also anastomoses with the ovarian artery. So mainly it supplies the uterus. It also supplies the uterine tubes, that is the intramural part of the uterine tubes, and also gives branches to the ovary and contents of the broad ligament. So these are all the structures which are supplied by the uterine artery. The next artery which we are seeing here is the middle rectal artery. So here you are able to see the middle rectal artery. So this is the middle rectal artery, which is again one of the branches of the internal iliac artery. Anterior division of internal iliac artery passes downwards and medially to the pelvirectal space. So the space which is present on either side of the rectum is actually called as the pelvirectal space, and through which you also have the lateral ligaments of the rectum. So there it goes and supplies the lower part of the rectum by anastomosing with the superior and inferior rectal arteries. Okay. So that is the middle rectal artery, anastomosing with the superior rectal and inferior rectal arteries. So it runs along the pelvirectal space, which is seen on either side of the rectum, and also gives a few branches to the urinary bladder and seminal vesicle. Okay. So finally it anastomosis with the superior rectal and inferior rectal arteries. So that is about the middle rectal artery. So the next artery is the internal pudendal artery, one of the terminal branches. The internal pudendal artery is actually one of the terminal branches of the anterior division of the internal iliac artery. So it is actually leaving the pelvis to the greater sciatic foramen. Then it will be related to the ischial spine. Okay, dorsal surface of the ischial spine, and then afterwards what happens is that it will be related to the pudendal nerve and nerve to obturator internus. Okay, so first enters or goes out to the greater sciatic foramen, leaves the pelvis, and then it is accompanied by the pudendal nerve and the nerve to obturator internus, then enters again, comes back via the lesser sciatic foramen, and it is mainly the chief artery which is going to supply these structures in the perineum, internal pudendal artery. The terminal branches, it will divide into deep artery and dorsal artery. So deep artery and dorsal artery of penis or clitoris. In case of males it is penis, in case of females it is actually called as the clitoris. So other branches of the internal pudendal artery. So the course of internal pudendal artery from the greater sciatic foramen then comes out to the lesser sciatic foramen. Then it is seen in the pudendal canal or Alcock's canal in the lateral wall of the ischiorectal fossa, and finally divides into deep artery and dorsal artery of the penis in case of males and the clitoris in case of females. So the branches of the internal pudendal artery, in the pudendal canal it gives inferior rectal branch. So which is going to supply your rectum, inferior rectal branches. Then perineal branch. So it gives us the perineal artery, perineal branch, which again divides into transverse perineal artery and posterior scrotal or labial arteries. Okay. So it gives out perineal branch, divides into transverse perineal branch and posterior scrotal in case of males and labial arteries. Then artery to bulb of penis. Artery to bulb of penis. Okay. In case of the males, or artery to vestibule of vagina in case of females, and then it also supplies the spongy urethra, urethral arteries, spongy urethra, urethral arteries, and of course the terminal branches which you are able to see, that is the dorsal artery and the deep artery. So deep artery of penis or clitoris, this is mainly female, so it is actually labeled as dorsal artery of clitoris and deep artery of clitoris. So mainly the branches are inferior rectal branch, then perineal branch which gives rise to transverse perineal and posterior scrotal or labial vessels, perineal artery. Then it gives artery to bulb of penis or vestibule of vagina, then urethral arteries, and finally terminal branches are deep artery of penis or clitoris and dorsal artery of penis or clitoris. Then we have the other terminal branch of the pudendal artery, which is the inferior gluteal artery. So here you are able to see the inferior gluteal artery, one of the terminal branch. Downwards and backwards it is passing between the ventral rami of the S1 S2 nerves and leaves the pelvis through the greater sciatic foramen. So it leaves the pelvis through the greater sciatic foramen. So it emerges below the piriformis muscle, emerges below the piriformis muscle, inferior gluteal artery, and naturally supplies the structures under cover of gluteus maximus. So with respect to the inferior gluteal artery and its further course and branches, kindly refer to the lower limb lectures. In the gluteal region, I have discussed in detail about this inferior gluteal artery. So that is the inferior gluteal artery, which is actually passing the greater sciatic foramen and then enters the gluteal region below the lower border of the gluteus maximus. So now coming to the posterior division of the internal iliac artery. Anterior division we have finished. The branches are mainly obliterated umbilical artery, superior vesicular artery, inferior vesicular artery, middle rectal artery, Obturator artery, Vaginal artery, Uterine artery. Then terminal branches. One of the terminal branches is the internal pudendal artery, and other terminal branch is the inferior gluteal artery. So now coming to the posterior branch, as I told you, they are mainly Iliolumbar artery, superior gluteal artery, and lateral sacral artery. So they mainly supply the abdominal wall muscles, posterior wall of the pelvis, and gluteal region. So they are not mostly visceral branches. They can be considered as the parietal branches, because the internal iliac artery branches, instead of dividing into anterior and posterior division, some authors prefer to divide it into a visceral and parietal branches. So the parietal branches are mainly Iliolumbar, lateral sacral, and the other one is the superior gluteal artery. Then of course the inferior gluteal artery also comes into that, whereas the visceral branches include your umbilical, superior vesical, inferior vesical, middle rectal, uterine, and vaginal arteries. So now we will try to just see in short about the arteries, these three posterior divisions. So the first artery is the Iliolumbar artery. So the Iliolumbar artery is one of the divisions. It ascends actually. So here you are able to see the from the posterior division, that is the Iliolumbar artery. Okay. So the Iliolumbar artery is actually given here. It passes upwards in front of the ala of the sacrum. So this wing-like process of the sacrum is actually called as the ala of the sacrum, and then divides into an ilial branch and a lumbar branch. So mainly divides into an ilial branch and lumbar branch. So ilial branch is actually present between the or beneath the psoas major and iliacus muscle, reaches the iliac fossa and provides branches to the muscles and nutrial branch to the ilium, whereas the lumbar branch ascends to the substance of psoas major and anastomoses in the fourth lumbar artery. So you are able to see the lumbar arteries, fourth lumbar artery. They are actually the posterior branches from the abdominal aorta, lumbar artery. So it anastomoses with the fourth lumbar artery and sends a spinal branch to the intervertebral foramen between L5 and sacrum. Okay, so the lumbar artery, lumbar branch anastomoses to the fourth lumbar artery and actually gives a spinal branch. So as I told you, iliac branch supplies the muscles around and also the nutrient artery to the ilium. So that is, you are able to see the Iliolumbar artery, how it is ascending on the ala of the sacrum and divides into an ilial branch and a lumbar branch. The next is the lateral sacral arteries. So mainly they consist of upper and lower, or you can also call it as superior and inferior. So you are able to see these lateral sacral arteries. They pass backwards and enters the pelvis through the greater sciatic, not to the greater sciatic foramen, enters through the pelvic sacral foramina. And then what happens? It descends in front of the lateral margins of the pelvic sacral foramina and mainly supplies the contents of sacral canal. So it mainly supplies the contents of the sacral canal, skin and the muscles posterior to the sacrum. So that is about the lateral sacral arteries. Enters to the pelvic sacral foramina and mainly supplies the contents of the sacral canal. The next artery is the superior gluteal artery. So it is also considered as one of the largest branch of the internal iliac artery. One of the largest terminal branches of the posterior trunk. So it exits the pelvic cavity again to the greater sciatic foramina above the piriformis. Enters the gluteal region above the piriformis or superior to piriformis, and then appears in the gluteal region and supplies the structures of the gluteal region. So that is about the superior gluteal artery. So here you are able to see the superior gluteal artery emerging above the piriformis muscle, and it ramifies below the gluteus maximus, mainly supplying the structures above the piriformis. So that is your gluteus medius, gluteus minimus. So minor arteries of the pelvis, mainly they include gonadal arteries. The gonadal arteries, abdominal aorta directly, the testicular artery in case of males, and the ovarian artery in case of the females. So mainly the ovarian artery descends to the pelvis, crosses the pelvic brim, and it divides into ovarian tubal branches which supply the respective structures. So ovarian suspensory ligament of ovary, and from there it enters via the mesovarian border and then hilum of ovary, ovarian artery. It also anastomoses with the uterine artery. Okay, so that is the ovarian artery, commonly called as gonadal arteries. So how it enters the suspensory ligament, mesovarian border, and also anastomoses with the branches of the uterine artery. So the next artery is the median sacral artery. The median sacral artery is actually the final branch or the last branch of the abdominal aorta, just prior to the bifurcation into common iliac artery. So ascends anteriorly in front of the 4th and 5th lumbar vertebra sacrum, behind the rectum, in the space in front of the pelvis, and it mainly supplies the structures behind the rectum, arterial supply to these regions. Okay. Then next is the superior rectal artery, which is actually a branch of the inferior mesenteric artery. So terminal continuation branch of the inferior mesenteric artery. So crosses the left common iliac vein and descends in the sigmoid colon. So in the ascending limb of the transverse sigmoid mesocolon, actually it runs and gives branches to supply the rectum and anastomoses with the middle and inferior rectal arteries. So that is the superior rectal artery. You are able to see here, which is a direct branch from the inferior mesenteric artery, anastomoses with the middle and inferior rectal arteries. So we have seen about the blood supply of the pelvis, mainly. So by now you would have understand the principle or the chief artery which is supplying is the internal iliac artery, which is divided into anterior and posterior divisions. So anterior division I have already summarized. Posterior divisions, mainly 3 branches: Iliolumbar artery, superior gluteal artery, and then you have the lateral sacral artery. So minor arteries are gonadal artery, superior rectal artery, and the median sacral arteries. Now coming to the veins. So mainly veins also, like the arteries, have parietal and visceral set, and mostly they correspond to the branches of the arteries which we have seen. So naturally it should be the branches of internal iliac artery. So same way internal iliac vein is mainly draining into it. So internal iliac vein actually joins with the external iliac vein to form the common iliac veins. So which gives rise to external, internal, and then the common iliac vein. So internal joins with the external to form the common iliac vein. So which is actually formed at the level of 5th L5 vertebra. So the external iliac vein continues as the femoral vein deep to the inguinal ligament, okay, and ascends along the medial side of the artery and unites with the internal iliac vein to form the common iliac vein. Now coming to the internal iliac vein, which actually runs in the posterolateral wall. Internal iliac vein actually runs the posterolateral wall between the artery, the ureter in front, and the lumbosacral trunk with the sacroiliac joint, and joins with the external iliac vein and forms the common iliac vein. So the tributaries, mainly They correspond with the branches of internal iliac artery except the Iliolumbar vein which drains into the common iliac vein, and one more is the umbilical vein. So except the umbilical vein and the Iliolumbar vein, the other veins, they are actually corresponding branches to the internal iliac artery, superior gluteal vein, inferior gluteal vein, vesicular veins, middle rectal veins. So that is the formation of common iliac vein after the union of the internal iliac vein at the level of sacroiliac joint it forms. So mainly the internal iliac vein receives blood from the superior and inferior gluteal veins, as I told you. Internal pudendal vein, so mainly it is from the lower part of the rectum, inferior rectal vein, and also from the structures from the perineum, okay, deep dorsal vein of the penis, okay, obturator vein, lateral sacral veins, these are all corresponding branches. So from the hip and thigh, lateral sacral vein from the sacrum, middle rectal vein from bladder and prostate in males and part of the rectum, vesicular veins from the urinary bladder, and uterine and vaginal veins. Now, what happens is, how do they drain is, the visceral veins, what we call it as the rectal, vesicular, uterine, these are all called as the visceral veins. They mainly form venous plexus around the individual viscera. So like in prostate, they form prostatic venous plexus. This prostatic venous plexus drains above into the vesicular plexus of veins. So the vesicular plexus of veins, first they are present in the space of Ritzius on the infrolateral aspect space between the bladder and the wall of the pelvis. So these vesicular plexus of veins will mainly receive the prostatic plexus. The prostatic plexus in front will receive the dorsal vein of the penis. So it will receive the dorsal vein of the penis, prostatic plexus. Prostatic plexus will communicate to the vesicular plexus. Okay. So the vesicular plexus is situated in the infrolateral surface, as I told you, in the space of Ritzius. And then what happens is, finally they form a single vesicular vein and drains into the internal iliac vein. Then through the paravertebral veins, it also communicates with the internal vertebral venous plexus, this vesicular plexus. So that one communication you should remember, and that I have again discussed its importance in the prostate gland. Then, like the prostatic venous plexus, vesicular plexus, we also have uterovaginal plexus. So uterine and vaginal veins, you have uterovaginal plexus, mainly they drain into the internal iliac veins, to the uterine vein and the vaginal veins, and partly into the inferior vena cava. Now how actually drains into the inferior vena cava is, since it anastomoses with the ovarian pamperiform veins, so right side will drain into IVC and left ovarian vein will actually drain into the left renal vein. So through this it partly drains into the caval system also directly. So that is about the vaginal, uterovaginal plexus. Then coming to the rectal, they also form venous plexus. So communication between the plexus at the region of pectinate line. So there actually it forms the anal canal. It is a communication between the portal vein and the superior rectal vein, because superior rectal vein through inferior mesenteric vein it drains into the portal system. Whereas middle and inferior rectal vein, what happens through internal iliac vein, inferior rectal through pudendal vein, actually again through the internal iliac vein drains into the vena cava system. Okay. So importance of this rectal plexus, again I have spoken in detail in my rectal and rectum and anal canal classes. So common iliac vein at the upper margin of the pubic symphysis by union of external and internal iliac vein. It mainly receives the iliolumbar and medial sacral veins. Okay. So like the lumbar veins, it will also receives the iliolumbar veins and the middle sacral veins. So then what happens at the level of L5, both the common iliac vein unite to form the inferior vena cava. So with that, we have completed the vessels of the pelvis. So that is the arteries and veins of the pelvis. So next we are going to the nerves of the pelvis. So coming to the nerves of the pelvis, it is mainly by the sacral plexus, mainly innervated by the sacral plexus, and also you have the coccygeal plexus. Then you have the autonomic nervous system, sympathetic and parasympathetic, mainly formed by your pelvis splanchnic nerves and contributed from superior hypogastric plexus and also from the pelvic splanchnic nerves, and from the superior hypogastric plexus we also have the inferior hypogastric plexus. So that is about the autonomic part. Then we have the mainly the other nerves from the sacral plexus. So mainly it is by the sacral plexus. So how actually the sacral plexus is formed? Upper four sacral nerves S1, S2, S3, S4, they join with the lumbosacral trunk. Okay. So that is the lumbosacral trunk you are seeing here, is situated on the posterior wall in front of the piriformis muscle. So as I told you, it is formed by the S1, S2, S3 and the S4 nerves, which is joined by the lumbosacral trunk. Lumbosacral trunk is mainly formed by L5 and descending branch of L4. The ascending branch of L4 joins the lumbar plexus. So L4 is actually called as nervi forcalis. So descending branch of L4 along with L5 forms the lumbosacral trunk. The lumbosacral trunk along with S1, S2, S3, S4 forms the sacral plexus, and they are all ventral primary rami. Okay, so they are all ventral divisions because dorsal division does not form plexus. So that is how the lumbosacral tract forms. And then what happens? The branches of the sacral plexus. The branches of the sacral plexus. So it gives branches, and the terminal branch of the sacral plexus is the one of the terminal branch is the sciatic nerve. So one of the terminal branch is actually the sciatic nerve, and other terminal branch is your pudendal nerve. The pudendal nerve is one of the terminal branch. So anteriorly it is related to internal iliac vessels, and it is present in front of the piriformis muscle, which we have seen in the last picture. So totally branches of sacral plexus are 12, only 5 supply the pelvis and the remaining 7 supply the gluteal and the lumbar region. So they mainly supply the gluteal region and the lumbar region. The 5 mainly supplying the pelvis are nerve to levator, ani and coccygeus. So nerve to levator, ani and coccygeus. Then you have the perineal branch. Okay. Then you have the pelvis splanchnic nerves from S2, S3, S4. You have the pelvis splanchnic nerves. Then you have the pudendal nerve. So main nerve which is supplying the lower part of your rectum, anal canal and structures of the perineum. Pudendal nerve, pelvis splanchnic nerves. Okay. Then you have the nerve to levator, ani, coccygeus, as I told you, and then the nerve to piriformis. So these are the 5 branches: nerve to levator, ani, and coccygeus, perineal branch of S4, pelvis splanchnic nerves, pudendal nerve, and nerve to the piriformis. So the other branches, mainly you have the superior gluteal nerve. Then you have the inferior gluteal nerve. Then you have the sciatic nerve, one of the large terminal branches. Then you have the nerve to obturator internus. Okay. So you have the nerve to obturator internus. Then you have the nerve to Quadratus femoris. So all these nerve to Obturator internus, Quadratus femoris, posterior femoral cutaneous nerve of the thigh. Then we have the Pudendal nerve, which we have already seen, one of the terminal branches, and perforating cutaneous nerve. So excluding this Pudendal nerve, 1, 2, 3, 4, 5, 6 and 7, these are actually the branches which is actually supplying the lower limb and the pelvic wall. So barring the pelvic branches which we have seen, that is the nerve to the levator ani and coccygeus piriformis, perineal branch of S4 nerve, pelvis splanchnic nerves and pudendal nerve. So exclusive of those 5 nerves, these 7 nerves are superior gluteal, inferior gluteal, sciatic, nerve to Obturator internus, nerve to Quadratus femoris, posterior femoral cutaneous nerve of thigh and perforating cutaneous branch. Obturator nerve, but this is actually from the lumbar plexus. Obturator nerve is actually from the lumbar plexus L2, L3 and L4. So superior gluteal nerve L4, L5 and S1. So these 3 mainly forms the superior gluteal nerve. So mainly carries fibers from the ventral rami, dorsal branches of L4, L5 and S1. So there you are able to see the superior gluteal nerve. So leaves through the greater sciatic foramen above the piriformis and supplies the gluteus medius and minimus muscle. Gluteus medius and minimus muscle and the tensor fascia lata. So that is the superior gluteal above the piriformis. The next nerve is the inferior gluteal nerve. It is from L5, S1 and S2. Inferior gluteal nerve is from L5, S1 and S2. So from the lower border of piriformis it emerges and it mainly supplies the gluteus maximus muscle. Okay. So mainly innervates the gluteus maximus muscle. So all these nerves and vessels we have already discussed in detail in our structures under cover of gluteus maximus in a lower limb lecture. The next muscle is the sciatic nerve, which is the one of the largest terminal branch and is also the thickest nerve in the body. L4, L5, S1, S2 and S3. It has got 2 components, a peroneal component and a tibial component. Peroneal component and tibial component. So leaves the pelvis to the greater sciatic foramen and emerges below the piriformis, enters the thigh between the greater trochanter femur and the ischial tuberosity. So at the upper angle of the popliteal fossa, it divides into the tibial and common peroneal. Next is the nerve to Obturator internus. So L5, S1 and S2 is the root value. So again leads to the greater sciatic foramen, nerve to Obturator internus. Appears on the dorsal surface of the ischial spine, that is to the lesser sciatic foramen, and mainly gives tweaks to superior gemellae. Okay. So mainly what happens, it gives nerve to Obturator internus. So medial to the ischial spine, pin structures, pudendal nerve, internal pudendal artery and nerve to Obturator internus. So it gives mainly to the Obturator internus as well as tweaks to the superior gemellae, the 2 muscles it innervates. The next nerve is the nerve to Quadratus femoris, L4, L5, S1. Again it emerges below the piriformis, structures emerging below the piriformis deep to gluteus maximus. Okay, so it mainly supplies Quadratus femoris and it also supplies the inferior gemellae muscle, and it is also giving an articular branch to the hip joint. So that is mainly about the nerve to Quadratus femoris. The next nerve is the posterior femoral cutaneous nerve of the thigh. Posterior femoral cutaneous nerve of the thigh. So here you are able to see the posterior leaves again below the piriformis, greater sciatic foramen, alongside of the sciatic nerve, and descends back of the knee. Mainly it is responsible for supplying the back of the leg and also gives a twixt perineal branches. Okay, so that is about the posterior femoral cutaneous nerve. So mainly supplies the skin of the posterior part of the scrotum or labial majora, that is its perineal branches. Next, coming to the pudendal nerve. So one of the important nerve is mainly formed by S2, S3 and S4. So S2, S3 and S4 mainly gives rise to the pudendal nerve. So leaves the pelvis to the greater sciatic foramen, and then what happens? This is the greater sciatic foramen. Then it is related to the dorsal surface of the spine of ischium. Okay, and then enters the perineum to the lesser sciatic foramen, and then runs in the pudendal canal on the lateral wall of ischiorectal fossa. So ischiorectal fossa is again a separate topic. There we will see about the boundaries of ischiorectal fossa. In the lateral wall you have a facial canal called as the pudendal or Alcock's canal. Inside this canal only, this pudendal nerve actually runs and mainly divides into perineal nerve. It mainly divides into perineal nerve and dorsal nerve of penis. So dorsal nerve of penis. Terminal branches. One is the perineal nerve. Another one is the dorsal nerve of penis in case of males and clitoris in case of females. Now, along its course in the pudendal canal, it gives inferior rectal nerve. So mainly gives the inferior rectal nerves. They accompany the corresponding vessels. Okay, and this inferior rectal nerve also supplies vagina in case of the females. So then the perineal nerve, what happens in the anterior part of the ischiorectal fossa, it divides into superficial and deep branch. Deep branch mainly supply the muscles of the superficial perineal pouch and the deep perineal pouch. So they are mainly muscular in nature. Okay, they are actually muscular in nature. Superficial, transverse, bulbospongios, ischiocavernosus, superficial, deep, transverse, perineal, all those things they supply. Whereas the superficial branch is actually cutaneous and gives rise to posterior scrotal or labial vessels. In males it is scrotal nerves, in females it is actually called as the labial nerves. Okay, and finally, as I told you, the terminal branch is the dorsal nerve of the penis or the clitoris in case of the females. So that is about the pudendal nerve. Next is the perforating cutaneous nerve. So it mainly carries fibers from S2, S3, pierces the sacrotuberous ligament and supplies the skin of the lower part of the buttock. So that is the perforating cutaneous nerve. So 4 quadrants. You can divide your gluteal region into outer and lower outer quadrant, then upper inner quadrant and lower inner quadrant. Okay, so these are the nerves mainly supplying, of which the lower inner quadrant is mainly skin of the lower medial part is mainly supplied by the perforating cutaneous nerve. Next, obturator nerve. I will just quickly skip over this obturator nerve L2, L3, L4 because it is mainly a branch of the lumbar plexus L2, L3 and L4. So doesn't innervate anything in the pelvis, just runs through the pelvis. So that is why it is included here, and naturally enters to the obturator canal. And then what happens in the medial compartment of the thigh? It supplies by 2 divisions, that is the anterior and the posterior division, runs between the obturator muscles, and ultimately it also supplies the knee joint. So in the pelvis it runs along the lateral wall, forming one of the boundaries of the ovarian fossa. So naturally referred pain of the ovary, so irritation of the obturator nerve can also be felt along the knee region. Then coccygeal plexus is mainly formed by the S5 ventral rami, actually mainly formed by S4, divides to the upper and lower division. Along with the lower division of S4, S5 and the coccygeal nerves, they mainly form, and it is situated on the pelvic surface, mainly supplies part of levator ani and sacrococcygeal joint. It gives anococcygeal nerve, which is arising from the coccygeal plexus and supplies the skin close to the tip of the coccyx. Okay, so mainly it supplies the skin close to the tip of the coccyx and also the anal region. So that is about the coccygeal plexus. So we have seen almost the somatic nerves so far, the branches from the sacral plexus and also the branches from the coccygeal plexus. So sacral plexus can be divided mainly into branches which supply the pelvis, the 5 branches, and the remaining 7 branches which mainly they are supplying the lower limb and the other surrounding regions. So the 5 branches mainly confined to the pelvis are mainly the pudendal nerve is one of the most important nerve. Then we have seen about the nerve to mainly the nerve to levator ani and the coccygeus, nerve to piriformis, then pelvis splanchnic nerves S2, S3 and S4. Okay, so I will come to the pelvis splanchnic nerves again, the autonomic component, and then about the nerve to piriformis. So now coming to the autonomic components, superior hypogastric plexus. So the superior hypogastric plexus, which you are actually able to see here at the bifurcation, aortic bifurcation here, what you are able to see here is mainly formed by contribution from the inferior mesenteric plexus. Central part, it receives nerves from the inferior hypogastric plexus. Then lateral part it receives from L3, L4 lumbar splanchnic nerves. The superior hypogastric plexus is mainly a sympathetic plexus. Superior hypogastric plexus is actually a sympathetic plexus, and mostly L3, L4 they convey preganglionic fibers. They mainly convey the preganglionic fibers. From this plexus mainly what happens is descends anterior and divide into right and left hypogastric nerves. So from the superior hypogastric plexus, it gives 2 nerves, which is the right and left hypogastric nerves. They are going to form the inferior hypogastric plexus after joining to the pelvis splanchnic nerves, that is the S2, S3 and S4. So the superior hypogastric plexus consists of preganglionic and postganglionic sympathetic fibers. Okay, so the preganglionic fibers is actually derived from the T1 to L2 segments of the spinal cord, and sensory sympathetic fibers concerned with pain. So from the uterus, urinary bladder and other pelvic organs, the sensory neurons are located in the dorsal root ganglia of the lower thoracic and upper 2 lumbar nerves. Okay, so here you are able to see the superior hypogastric plexus mainly from the inferior mesenteric plexus and also from the L3, L4 lumbar splanchnic nerves. It is a sympathetic plexus. So next you are able to see the right and left hypogastric nerves. So right and left parts, right and left hypogastric, they form 2 plexus, right and left plexus by the side of the rectum are present on the posterolateral wall, lateral to the rectum, and dense network of fibers. It is composed of both sympathetic as well as parasympathetic. So postganglionic fibers are derived from the hypogastric nerves, and whereas preganglionic fibers are actually coming from the S2, S3, S4 pelvis splanchnic nerves. So these pelvis splanchnic nerves, they are mainly responsible for the motor fibers. Okay, pelvis splanchnic nerves, which stimulates the peristalsis in case of the lower gut, because they join with the inferior mesenteric plexus and also supply your left colic flexion, descending colon and also the sigmoid colon. Now apart from that, S2, S3, S4 they supply the bladder. It is the nerve of filling as well as the nerve of emptying. Okay, nervi urgentis. They are actually called as nervi urgentis because they are mainly responsible for erection of penis, which is actually a parasympathetic part, whereas ejaculation is sympathetic component. Okay, so they are also responsible mainly supply the uterus, myometrium of the uterus, inhibits the contraction of the uterine myometrium and conveys some pain sensations from the cervix of the uterus. Okay, cervix of the uterus. So they are nervi urgentis mainly for the erection because vasodilatation of the erectile tissue of the penis. Then they inhibit the sphincters of the lower part of the gut, inhibit the sphincters, but what happens? They initiate the peristalsis. So inferior hypogastric plexus. So that is about the inferior hypogastric plexus. Right and left hypogastric nerves forms two plexus after joining with the S2, S3, S4 pelvis splanchnic nerves. So right and left hypogastric nerve and pelvis splanchnic nerves and sacral splanchnic nerves also they join to form. So the functions which I have told you now. Sympathetic trunk, finally the sacral part where the sympathetic chain, which is actually the four ganglia are present, they descend on either side. You are able to see sacral trunk descend on the inner side of the sacrum, medial to the sacral foramina, and finally four ganglia. The final one they fuse in the midline to form the ganglion impar. They mainly fuse to form the ganglion impar. The sacral sympathetic chain, which you are able to see here, consists of four ganglia, and the final ganglia actually what happens is forms the ganglion impar. So clinical aspects, mainly ligating during hysterectomy, when you want to ligate the ligaments and the uterine artery, you should be very careful so that not to damage the ureters, because it crosses the artery above and in front, which is remembered as water under the bridge. The ureter, water is actually under the uterine artery. So ligation of the cardinal ligament, care should be taken not to actually ligate the ureter. Pudendal nerve block is mainly given during some surgeries of the perineal region and also during episiotomy, delivery, to actually dilate the vaginal canal. So any somatosensory pain which is arising from the perineal region, for this also what happens? Usually the needle is introduced through the vaginal mucosa just medial and posterior to the sacral spine. So just medial and posterior to the sacral spine. There you should be very careful because the pudendal artery lies in close proximity to the pudendal nerve. Okay. So then one must aspirate before and during the injection of local anesthetic. Okay. So that is very careful, one of the guidelines which you have to follow while you are giving a pudendal nerve block. Okay. Because of the close proximity of the pudendal artery, which is actually lying in very close relationship to the pudendal nerve. So during the injection one must aspirate, and also before that care should be taken. So that is all for today. Thank you very much for your patient listening.